Hi, I'm Dr. Jenny Dhillon from Life Aveda, and today we'll be talking about fatty liver. Very commonly heard, and a lot of people suffer from fatty liver. But do we actually know what fatty liver is? So I'll break it down to you. When your liver accumulates more fat than it should and does not process the fat, that is when you develop a layer of fat over your liver and it causes fatty liver. Usually it has almost no symptoms, it's asymptomatic, but the symptoms that it causes once it reaches a certain grade, and just to simplify it, fatty liver is divided in grades, grade 1, 2 and 3 and so on, and it has various types. So the most common form of non-alcoholic fatty liver is caused due to excessive calorie intake and excessive junk food intake, because we have really erratic lifestyles and very unhealthy eating habits. So fatty liver is very common and it can be controlled and reversed. So the symptoms that are caused due to fatty liver once it reaches a certain grade, as I told earlier also, it causes fatigue, it causes a lot of weakness, lethargy, and in some patients it causes excessive weight gain, and in some it causes weight loss. And it also causes swelling in your abdomen and your legs, and it is classified as ascites, which is fluid retention or water accumulation in the abdomen and the belly area. So it also causes yellowish tint to your skin, and your eyes, they turn really pale. And the very common symptom that a lot of patients suffer from is feeling of fullness in the abdomen. So you eat very little, even though you feel hungry, you eat very little and you feel bloated, and there's a feeling of fullness that you cannot just eat anymore. So what are the challenges that people with fatty liver face? So they cannot, it causes a lot of societal pressure also. You cannot join your friends or your colleagues to any dinner parties or any parties as such, and you cannot, you don't feel like going out, you're lethargic all the time, you don't feel active, you don't feel motivated to work, you're not feeling productive. So it causes a lot of mental pressure as well. Moving on, we need to get some investigations done to figure out the type of fatty liver you have. So we can get your blood work done, which consists of your liver profile test, liver function test, and we can figure out if your SGOT-PT and alkaline phosphatase is imbalanced. That means there is something wrong with your liver. You can get your ultrasound done, CT scan, MRI. But ultrasound cannot figure out the type of fatty liver. It can certainly tell you the grade of fatty liver you have, but it cannot differentiate between an alcoholic fatty liver or non-alcoholic fatty liver. And if your doctor thinks that it should be investigated further, they can get a fibroscan done or your liver biopsy. Now, moving on, I'll tell you some home remedies that can be done to curb constipation and acidity, GERD, which is the gastric reflux. So that is usually caused by fatty liver. So number one, you can take a few fennel seeds, which is also known as sof, and boil some water and add a teaspoon of fennel seeds in it, and let it steep for a good 10-12 minutes, and then that you can consume that. Have it 3 to 4 times during the day before meals. And then you can also have coriander water following the same method. 3 to 4 cups of coriander water is good. Coriander or cilantro or parsley, anything will work. You need to cut out the raw food consumption, be it salads or even fruits in some patients. So if you're taking an apple, you might not be able to digest it that easily. It's better to have a blanched apple, dipping it in hot water for a few seconds and then peeling off the skin. That will be digested easily rather than a normal apple. And then you need to cut out on having raw salads. Have steamed salads. That is much more easier to digest. And peppermint tea is a very, very good option. You can just keep a few tea bags in your bag and have it sip on your peppermint tea throughout the day. That will control your acidity and other digestive problems you might have. Moving on, if you think that your fatty liver and your symptoms are not being controlled with these home remedies, then you need to take it more seriously and move towards getting it treated by a qualified doctor. In Ayurveda, we have a huge range of herbs that help in fatty liver and promoting good liver health on the whole. So starting with Bhumi Amla. Bhumi Amla is a very good herb. It regenerates your liver cells, detoxifies it. Then there's Kal Megh. Kutki helps a lot. And then Punarnava, it's a mild diuretic that will help get rid of the ascites, that is the water accumulation in the abdomen. So all these herbs are available with us in single herb formulations, and they are made with extracts, good quality extracts, which makes them result oriented. And I have seen my patients recovering from fatty liver completely with the help of these herbal formulations and taking good care of their diet. And you can too. If you want to take consultation from me or our panel of doctors, the details are on your screen. You can contact us and take proper consultation and start a proper treatment. So till then, take care, eat well and stay healthy.